Hello, welcome to my restorative physical therapy. I'm Dr. Jenny Pruitt, and today we're going to be talking about SIJ or sacroiliac joint pain. Hallmark signs of this are pain at the sacroiliac joint. So when we're talking about this, we're really talking about the pelvis. The pelvis is a ring of three bones. The two hip bones are called the ilium or ilia for plural. And then the triangle-shaped bone at the bottom of our spine is called the sacrum. And so in our buttocks, on both sides, we have a sacroiliac joint on either side. And when this gets irritated, we call it sacroiliac joint pain. So hallmark signs that you have this is it's one of the few conditions where we can say my pain is here. Somebody claimed that as a test, interestingly enough. I thought that was really funny. So Fortin finger sign. So Fortin got to name a test where you point to your body part that hurts, and that's an actual legitimate test. But for other conditions, you can't just point to where it hurts and assume that it's something, but this one's a good one for that. When does it hurt? So it typically hurts with, we say, single limb stance. So when you're standing on one leg, it'll strike you. So when I've had brief stints of this in the past, it's like when I'm trying to stand and put my pants on. So that like stance leg, I'll just kind of get a sudden stab into my butt cheek, and it does not feel good. And with walking, so that weight bearing leg usually, so whichever leg is holding up your body weight, once you transition onto that fully supported phase, you'll get a quick jab in the buttock, which is super uncomfortable, kind of jolts you. When I had it, I felt like it was just kind of random lightning strikes in my butt cheek, and it did not feel good. So that is sacroiliac joint pain. Times when you need to see a doctor. It's rarely necessary, but as with a lot of these things, it's more, I'm making sure that you're not mistaking it for something else. And so if you have pain, numbness, or tingling into a leg that is intense, that's actually probably not coming from the sacroiliac joint. It's probably something else, and you should talk to your doctor about that. And then lower extremity leg weakness on that side too. So like sensations like the leg wants to buckle or something like that. That is also not sacroiliac joint pain. Buckling because it's super painful is another story, but true feeling of weakness in the leg where the leg feels like it wants to buckle out from underneath you is probably something else and should be checked out by your doctor. But if you are like I was in the past and had those kind of random shooting butt cheek pains, sacroiliac joint pain, this tip sheet is for you. So check out those top tips and exercises on the tip sheet now.